Hi, good evening. Tonight I'm going to talk a little bit stream of consciousness and just give you some reflections I've been thinking about in terms of technique for therapists. So this video is for you therapists out there that want to hear a little bit about some techniques or technical advice I have found helpful in my work and have learned from some of my own mentors, supervisors, therapists about ways that we can engage clients and work with them in helpful ways. Most of what I'm going to share right now comes from a psychodynamic therapy approach, non-directive, where the client's associations and what they bring up takes the lead in the session, as opposed to more of a practical CBT approach of trying to focus on practical changes in a given session. So the first thing I like to think about when I go into a session with a client is, first of all, just getting a little bit of a read on the room. How does it feel with the person, their nonverbals, their body language? Do they seem tense, relaxed, happy, depressed? What's the affect like? So I just kind of like to check in on that and feel my way into that. And I also try to center myself and ground myself so that I don't feel any pressure to um, make conversation too quickly or rush away from a silence that's maybe the client just warming up to saying something or figuring out what they want to say. Sometimes it can be hard to know the right balance between making it comfortable for the client and helping them get started if they need that help versus giving them enough time and space to gather themselves and come up with what they want to start the session with. Another thing is putting myself in a space where I'm able to not feel a pressure to fix something or change something or make something be different for the client, but I'm able to actually just empathically immerse myself in the session and in what the client is saying or not saying, what things feel like. I'm putting myself in a mind space where I can listen to understand and try to reflect back to the client what I'm sensing from what they're experiencing or feeling in the moment, as opposed to trying to respond to an internal pressure to fix something or make something be better or make things be comfortable. So it's really grounding myself so that I don't feel pressured and I'm able to relax and just get into like a listening type of mode. Another thing I think is really important is that clients a lot of times engage us in ways that are maybe based on what are called in self-psychology self-object transferences. And those are ways that clients use us for their own needs, their self-esteem needs or their ego, or to regulate shame or for a certain function. So sometimes clients will talk to us in a maybe less formal, almost like we're friends or buddies type of way. Sometimes clients will idealize us and put us on a pedestal. And we can sometimes feel a little bit uncomfortable with that, but the client may have a need to do that for therapeutic reasons. And so learning how to play along and be comfortable that we can stay in our role as the therapist and still try to make things therapeutic without needing the client to move away from engaging with us in a way that maybe fills a need for them. I think a lot of therapists have a really hard time being idealized or getting compliments from a client. Sometimes I think this can be even harder than a negative transference where maybe the client is upset with us or having negative reactions to us. Something that feels too positive, a lot of us shy away from that. I think it's typical or common in therapist personalities that we don't like too many compliments or being put on a pedestal. And sometimes, of course, there's a fear that if we're put on a pedestal, we'll fall down from that pedestal. And so sometimes we prematurely close off or try to shut down the way the client is trying to use us. And I think if we play along and let the client form the type of connection with us that they need to form and trust that we can still stay in our role as a therapist and be reflective about it and think about it, is um, I think can be very helpful to be able to just sort of go along with the way the client engages us. Every client is their own person. They have their own rules of engagement, their own things that they're comfortable with, things they're not comfortable with, ways that they project, things that ways they interpret things. Some clients take things very personally. Some clients tend to blame other people. Some clients blame themselves too much. Everyone has their own ways of interpreting the world and engaging with the world and interpreting things the way that we do as part of the process of learning the client's internal world and learning what we could say to them and how they think about things and being able to talk to them about that. We first have to make it possible for them to play some of that out so we get some of that experience with them in real time. And in a similar way, when we want to talk about or address the transference, so the way the client is perceiving us in a given moment or the therapy setting or the way that they're projecting based on past experiences or expectations or templates, scripts onto the current situation. Part of how we do that is we look for examples in the here and now of where a client might be feeling or experiencing something that they're talking about, right? Is right now feel like an example where you're being misunderstood or abandoned, or where maybe I'm judging you, or does right now feel like an example where you have to accommodate to me or do what other people want, people please, right? If you are able to bring it into the here and now, it makes it much more emotionally present and alive for the client. In the same way that I think it's hard for us sometimes to wear the client's impression of us without changing it, right? Meaning they're going to have certain attributions that they project onto us. Maybe they see us in an idealized way, maybe they see us in a negative way, maybe they see us in a way that is just distorted of who we are, right? So I might think of myself as a warm person and a client sees me as cold, or I might think of myself as a very intellectual person and a client sees me as not so smart or whatever it is, right? People have their own attributions that they project onto us. So learning how to wear those, whether they're negative or positive or just different than how we see ourselves without feeling like we need to change that. And also being able to wear positive attributions that may be uncomfortable, I think goes along with also learning how to receive the client's love and gifts in ways that maybe we're not always so comfortable with, not pushing away a certain amount of intimacy or vulnerability that comes with clients trying to actually share gratitude for the work we're doing with them or say they feel close to us or dependent on us or how much we've helped them. Learning how to receive that gracefully, right? And just say thank you. There's a lot of maybe it's complicated in terms of actually receiving physical gifts from clients, right? There are certain guidelines about that ethically, and different people maybe have different opinions about that. But I think in general, when the client tries to give us back something, right, to not have to undo that that way of them trying to maybe even the playing field just a little bit or putting ourselves in the more receiving position where we're taking something from the client that's being offered to us. Sometimes could be super healing for the client or it could be conversely very rejecting if we push that away. But I think we're not always so comfortable with that as therapists, with taking or being taking from the client when we're in our role and learning when it's appropriate to do that, I think is really helpful. And across the board in general, in terms of what I'm talking about tonight, I think it's important to know how to be human and make good judgment calls about when to receive from the client, when to self-disclose to a client, when to be real with a client, but still being able to at the same time stay in your therapeutic analytic role, right? Where you're still trying to think about what's good for the client and be reflective about what you're doing and, think through the transference and countertransference dynamics. Stay within ethical guidelines, try not to do harm to the client. So we're able to keep an ethical framework for ourselves, but we also don't want to get too scripted where we're very focused on following certain rules and we can't bend to meet the client where they're at or to go where they need us to go. I think it's also really important to learn how to respect the client's pace and not pry, right? Or not ask too many questions until the client starts to bring things up or let us know that they're ready to talk about something. One thing my analyst taught me is that when people dream about things or start to talk about something in a dream or they bring up material, that usually means that they're ready to face that part of their unconscious. Usually the unconscious will protect us from things we're not ready to face, and we want to respect that process. So we don't want to dig in too much to clients or, go into traumas or pry for maybe repressed material or things like that before the client shows us in some way that they're starting to bring that material to consciousness, which is a signal that they're ready, even if they're ashamed or uncomfortable or it's hard for them to talk about it. But the fact that they're bringing it up, at least on a content level, usually means that there's some level of readiness to face that part of their unconscious. I also think that tone and body language and even visual metaphors like this to represent connection, for example, reach the client's unconscious in ways that words don't always. So we want to be able to know how to evoke affect and see things that bypass intellectualization or the client's resistance by speaking in ways that are that punctuate, right? With our tone, we can punctuate certain things, right? I think you felt really small in that situation. It sounds like your father really had a big impact on you, right? Just using our tone to sort of emphasize or highlight certain words that we want really to reach the client in a certain way more affectively. Sometimes leaning in, looking at the client a little bit more. Intently or looking away. There are a lot of things we do with our eyes, with our gaze, with our body, with our tone that help a client either feel safe or not feel safe, and that also kind of respond to their need to either feel more connected or less connected, to have more of a boundary in the moment and less contact or more intense contact. So learning how to deepen the intensity or lower the intensity with our tone of voice, with the way that we highlight certain things that we say or the way that we turn or look at the client, bringing them back into connection when they're trying to escape or respecting that, depending on our sense of what they need in the moment, can be really helpful as well. I think it's important to remember that we as therapists have an unconscious too. Sometimes we're not aware of our reactions, or a client may pick up on something or tell us we're reacting a certain way and we it feels very untrue to us, or it doesn't connect to how we feel. It's not aligned with how we're feeling on the inside, but we want to sort of have the humility to know that we also have an unconscious and there may be things in our behavior or the way that we're interacting that we're unaware of. So if a client tells me something about myself that I want to defend myself from or that doesn't feel real, a lot of times I will still be tentative. I'll say, I'm not aware of feeling that way, but tell me more about that, or I'm going to think some more about that. So I leave it open. I try not to shut it down because there may be some truth to it, and it may be truth that's taken out of context or misinterpreted. So sometimes clients, especially if they have a trauma history or they've learned to be sort of hyper vigilant to what other people are thinking or feeling and tune in on a very minute level, right, to nuances in our body language and things like that. They may pick up on something in us. Maybe we're withdrawing from them a little bit or a little less engaged or maybe more tired than usual that day. And probably their perception is accurate. That's usually what I assume for myself, but their interpretation may be inaccurate. So, um, maybe if I'm a little more distracted one day because of something in my personal life, a client who's super sensitive or empathic may pick up on that. And they may be accurate, but their interpretation or explanation of what that means about them, right? Or maybe if they take it personally or they think it means I'm bored by them or something like that, might not be accurate, right? So it's always good to allow clients to tell us or help make it safe for them to tell us when they feel like they're picking up on something in us and to trust those perceptions and to validate that. I think a lot of mental illness, especially for people with trauma, comes from having our realistic perceptions not validated, right? Where we pick up on something that's real and maybe we don't understand it 100%, but people basically disconfirm what we're actually experiencing or what our bodies are telling us is true, right? So we don't want to repeat that experience. We want to be respectful of what people say they're picking up on us and know that we have an unconscious too. And I think a really good piece of advice that I got as well from one of my own analysts was not to be like afraid to have our own feelings in therapy, right? We don't want to get taken over by our feelings because we still want to be able to think and feel at the same time and to be able to not, we don't want to like experience exactly what the client experiences, right? If a client is sad about something, we don't necessarily want to feel as sad as the client or exactly sad like the client, but we want to feel a piece of their sadness and still be able to be separate and be able to think about it at the same time. But it's very important not to be afraid to have feelings, right? I think that's very important in therapy, that the therapist shouldn't try to be too detached or defend against having their own feelings or suppress it because, first of all, that's not possible and it's not really helpful to the work. It's much better to be able to experience yourself as feeling and just try to work with those feelings. Ask yourself what they mean or how to cope with them. Be able to kind of hold those feelings without getting taken over by them, but not try to not have feelings in the first place. A lot of the data that we get about clients, a lot of what we learn about them, has to do with emotions that are evoked in the sessions, and that can tell us a lot. So it's very important. It's helpful to be open to that in ourselves, right? To view ourselves as this sort of um, tuning fork or tool that can pick up on certain things or resonate with certain things without being taken over by it and still maintain a therapeutic posture, but be able to actually tap into those feelings. I think that's really important as well. Okay, so I think those are my thoughts for now. I definitely would be interested in hearing from others, other therapists or lay people, what you found helpful, what you think makes good therapy, and maybe we can continue the conversation. Feel free to post in the comments below, and I look forward to hearing from you.